Hello, welcome to the Oriental Medical Digest. We have 5 senses, and if we lose just one of them, it can be difficult to lead a normal life. Problems with the nose, being the center of our face, can easily have a harmful influence on other organs. We've all experienced the annoyance of a stuffy and runny nose. Have you ever wondered why this happens? Today, we'll look at one very common nasal disorder called splenitis. Empyema and allergic splenitis are the most common forms of splenitis. While allergic splenitis is identified by the swollen nasal membrane, empyema accompanies pus and secretions inside the nose. Treatments and causes of these conditions are very different. What are the causes of allergic splenitis? Usually, allergic splenitis is caused by pollen, ash, cement dust, and ticks. Drastic changes in climate and temperature can also cause splenitis. According to an ancient Oriental medical book called Dong-i Bogam, empyema is classified as a Biyan, and allergic splenitis is classified as P-Ku. The symptoms of empyema and allergic splenitis are a little different, but a runny nose, sneezing, nasal congestions are common symptoms in both conditions. In Oriental medical theory, all human organs are reflected in the meridian line. Doctors determine the treatment based on the trouble point on a particular meridian line.
The nose and lungs are closely related to each other in Oriental medicine. The circulation of the keyhole flows from the lungs to the thumbs and then flows to the nose. If the lungs have a fever and are exposed to cold winds, its functioning is debilitated. This may result in a variety of nasal problems, such as allergic splenitis and empyema. To cure these nasal problems, the liver functioning should be corrected first. If the lung functioning is normalized, it helps circulation to the keyhole point. This is the principle of treatment to cure nasal problems such as splenitis and empyema.
Splenitis can be caused by weakened qi, which leads to the decline of the functions of the lungs and the immune system. Besides weakened qi, since hereditary factors are another cause of splenitis, information about the patient's family history must be obtained prior to treatment. Doctors can also perform 경락 공능 test to check the overall conditions of the body and see how splenitis is affecting internal organs. Splenitis can be divided into 2 categories, allergic splenitis and eczema. In Oriental medicine, treatments for these 2 conditions are similar. These treatments not only address the affected area, the nose and the sinus, but also improves the function of the lungs, which are closely linked to nasal disorders. Acupuncture therapy is the first step to heal splenitis, and this therapy is applied to both allergic splenitis and empyema patients. Where can we apply acupuncture to cure splenitis, and what kind of results can we expect?
Acupuncture is also good for empyema and allergic splenitis. We apply acupuncture to the 혈 points when these diseases are caused by bad fever. The chanjuk is close to the end of the eyebrows, closest to the nose. The 미충혈 point is on the forehead at the hairline, and the kokcha혈 point is beside the 미충혈. Application of acupuncture to these points reduces fever. Next, the picheonhyul is at both sides of the nose. and the 피교혈 is at the center of the eyebrows. Acupuncture is applied here for nasal problems that are caused by cold wind. The 영양혈 is at the rounded ends of the nose. The 비화료혈 right below the nostrils and the 소료혈 at the end of the nose are all related to the circulation of the 기혈 in the nose. These 8 혈s are used to treat runny noses, sneezing, stuffiness, empyema, and splenitis effectively.
In addition to natural acupuncture, electric acupuncture, which is a form of acupuncture that sends an electric current through the needle, is used to cure splenitis. Also, ultraviolet ray therapy is used to further improve the results. The same types of acupuncture therapy are used to cure allergic splenitis and empyema, but the herbal medications prescribed are very different. There are quite a few herbs here. Can you tell us what this remedy is used for?
These herbal ingredients are needed for the prescription 피체황류방 to cure allergic splenitis and empyema that clog the nose and create fever and inflammation.
I see. So what are the main ingredients then?
This is yeongyo, which acts as an anti-inflammatory. It is used for nasal inflammation and for swollen membranes inside the nose. This is kwakhyang, which is the best ingredient to cure allergic splenitis. It eliminates excess body water and enhances body energy. Next, this is teksa, which is usually used to treat a runny nose. The first part of the treatment is to dry the runny nose, and the second part is to increase urination to decrease the amount of excess fluid in the body. Teksa is good for the second part of the treatment. It improves the elimination of water from the body. These herbal ingredients are needed to prescribe 피체황류방, which is good for allergic splenitis and empyema.
The use of Oriental medicine to heal splenitis has yielded excellent results. Especially, the herbal medicine boosts the patient's immune system to effectively fight splenitis. These x-rays were taken before and after the therapy. The secretion in the nose has disappeared completely after treatment. Today, we looked at Oriental medicine's treatments for splenitis. The first symptoms of splenitis are a stuffed and runny nose and excessive sneezing. As the disease develops, more serious symptoms like loss of memory, blurred vision, and dental problems may arise. This is why it's important to address the cause of splenitis rather than temporarily suppressing the symptoms. That's all we have for today. Thank you for joining us, and see you next time.